Hello psychology students, Mrs. Olson here. This is part 2 of our video lesson on drugs and consciousness. So, the second category of drugs we will be learning about are hallucinogens. Now, what happens when someone hallucinates? If you said that they see, hear, feel, taste things that are not necessarily there, you are correct. The first note reads that hallucinogens cause changes in perception of reality. And really, that's why someone takes a hallucinogen, so that they can change the perception of their reality, of what is going on around them. Okay? Now, examples, and by no means is this list exhaustive. Is it the full list of hallucinogens? These are only examples of them. You might have heard of LSD, mushrooms, ketamine seems to be in the news a bunch lately. There's another chemical called DXM that is found in cough syrup, and actually people do take mass quantities of cough syrup to experience a hallucination. Okay, so when somebody hallucinates, they see, hear, feel, or they taste things that do not exist. All right. Now, when somebody is high on a hallucinogen, it can impair their thinking. Well, that's all of this part up here, right? It can impair thinking. It can cause panic attacks, which never has a positive sort of connotation, or they can experience flashbacks. And again, this is something that never feels good to the person, but that's what hallucinogens can do when those chemicals are in the body. Okay? All right. So, that's kind of what happens psychologically, or can happen psychologically. Biologically, so inside of the body, a hallucinogen can elevate someone's heart rate. It can increase blood pressure. None of those are necessarily good, especially if you aren't exercising. And it can actually dilate your pupils. So have you ever been to the eye doctors and you've had your pupils dilated before? It allows in a lot of light and you can't control it and it hurts, right? All right, so in this lesson, we are going to move on to a third category of drugs called opiates, which are definitely making the news right now because the media really has dubbed it the opioid crisis. And of course, there is mass amounts of people using opiates and becoming addicted to them. Okay, so I'm going to move me again. Opiates, they're also called narcotics, and what these do is produce analgesia. And so this is just a medical term for pain reduction, which is why some doctors have prescribed opiates so that it can help people, say, after surgery with pain that is associated from, like getting your knee worked on and sewed back up, right? So it helps to help somebody feel better because it reduces pain. Okay, so it says that prescription opioids are used to block pain signals between the brain and the body. So if somebody has had, for example, knee surgery, they might be prescribed OxyContin so that the healing process that happens can be painful, right? Your skin, your muscles, your tissue, that's kind of cut through, sewn back up, and that hurts. So the prescription opioids are used to block the pain signals that are being experienced, say, after surgery. Now, most commonly used opioids are OxyContin, Vicodin, fentanyl, and heroin, okay? And of course, all of these can be abused. And of course, heroin is a synthetic that is produced by man. All right. There we go. All right, so this graphic is showing you how opioids interact, what the messages they send out into the system. So start at the bottom where it says number 1, transduction. So somebody experiences trauma, for example. You can see where the opioids interact. I'm trying not to move my mouse so that doesn't come up. You can see number 2 at the bottom, the transmission of it, right? And then at the very top, where you see the brain, there's a box that says opioids act here. Okay, so opioids are still prescribed for pain reduction, but there is somewhat of a movement within the medical community to not prescribe them as much because people become addicted to them or can become addicted to them and then abuse them. Okay, so this graphic shows you, actually I think my animation's out of, yep, it's out of order a little bit. Okay, so there we go. So opioids can slow breathing, they can cause constipation, don't know why you would want to do that to yourself, nausea, and they can make someone confused or drowsy. So this animation, this graphic, which is animated, is titled The Effects of Opioids, Opiates on the Brain. Okay, so I suggest pausing it so you can take the time to read and kind of look to see what happens in the brain. I am going to go to the next slide. Or, no, I'm not. It can be highly addictive. Okay, we kind of said that. All right, and then here is another one, and it says your synapse with opiates. Remember that the synapse is the area between the neurons so that transmission can happen. Okay, and then here's another one, the effects of injecting opiates. So once again, on each of these, which I think are great animated graphics, pause so that you can read them and look at them a little bit longer. Okay, so we're going to move on to another category of drugs called stimulants. All right, it might be morning for you, it might be afternoon for you, it might be evening, but have you ever used a stimulant? I'm going to raise my hand and say, yes, I drank coffee this morning. So coffee is a stimulant, the caffeine in it, but we're going to be talking about illegal stimulants, okay? Now the first one is going to be, actually the first note is the definition of a stimulant. So it reads that stimulants elevate mood, hey, coffee, right? Increases feelings of well-being and increase energy and alertness, which is why many Americans throughout the country drink coffee in the morning so that they can experience all of these feelings and get started on their workday. But we're not going to be talking about coffee necessarily. We're going to be talking about two illegal stimulants. And the first one is going to be cocaine, okay? So remember that dopamine is a naturally occurring chemical. It's a neurotransmitter that we produce. All of us humans produce dopamine. Well, the chemical message that cocaine sends out really is that it blocks dopamine. So please imagine the graphics that we've been using showing neurons, okay? Cocaine gets in the way of the uptake of dopamine, and so what happens is that in the synapse in the neuron, there's a whole bunch of dopamine that can't get to where it's supposed to go, so the the buildup of the dopamine, that is what is creating the high when somebody has the cocaine in their system, okay? What else does cocaine do? Well, Biologically, it constricts blood vessels, right? That's never a good thing. We want our blood vessels to keep the constant flow of blood going without anything constricting or getting in the way. Here's another one. Increases heart rate, increases irritability, restlessness, and paranoia. All right. Okay, still talking about cocaine, we are on the next slide, and it reads that cocaine stimulates nerve cells that control the heart. Okay, so specifically what it does within the heart region is it makes a rush of a chemical messenger called noradrenaline. It makes another rush of this chemical. So noradrenaline is usually released when we're in danger. It is designed to make the heart pump faster, okay? So somebody that is high on cocaine, their heart rate increases, they have this rush of noradrenaline, and they are going, okay? There we go. Okay. So, cocaine also kills off dopamine receptors, and remember that dopamine is one of those feel-good chemicals that our body naturally produces. And so, because it kills off those receptors, users have to use the cocaine just to feel normal. So remember, the buildup of dopamine in the system is what is creating the high when somebody is on cocaine. And because those receptors for that feel-good chemical are cut off, essentially, killed off, the person who is addicted to cocaine has to keep using cocaine in order to feel good, to feel normal. Okay? So, this is where I'm going to end part 2 of our discussion on drugs in consciousness. And ending with this slide so that you can look at it just a little bit longer.